we always speak. So sometimes it's just going to the small groups. You will go into people with disability. You will go to the women's groups and ensure that as you're setting the meetings with them, you set meetings at times that are appropriate for them. A mother at 10 o'clock might not be able to come because that's when she's washing dishes or washing clothes. So you think about all these aspects.
Rebecca?
I think what I would say is at the design level, you involve the community, but they are part of the plan. They are the ones who give the ideas of the designs. I know we have done that currently at the Nairobi Rivers, where we are having the community engagement, and they are the ones who are giving the designs on how they want the area to be, because they are the users, so that they can own it, they can protect it, they can defend it, so that it is their project. But, and I know it has really, they've come up with amazing ideas, because what you think is right for them might not be. But if the designs are coming from them, they will really be part of the project and on the project. And another thing, I know we also do a lot of dialogues. We really doing a lot of river dialogues, especially now at the river. So to have ideas or to hear what they have in mind. We have the old people who have been there, and we have the young people who are coming up. So we want to match all the ideas together so that we are not leaving anyone behind. And another thing, we are mapping. We map the people so that you know who is interested in what, so that you group them together for better ideas. Thank you.
Thank you, Mama. Doing good job for them.
Okay. Yeah, I think it's all about community consultation, and I've always said that. I think if you're going to develop a space, you need to really have everyone involved. Any part of the community, you can't leave one part out. I think sometimes people with disabilities are a huge group that gets left out. And I think you have to look at everything you do is how are the people with disability going to access? Are they going to enjoy it? Are they going to have the same things? So I think it's really important that you cover every group. You have a representative of every group. And that really the project can't start till you have that. You need to, because everyone, you want to make sure that every group can use the space. And something in that space represents them. And that's the only way that it will really be successful.
Our community approach it actually seems we live as a group. And as you all understand, we have existing groups for women. Of course, we are working for them. But even as we give the voice, and we also start by listening to them, so that whatever interventions we are giving from what we are telling us. And we have, I had Prof talk about the integration of mental health with primary health care, and I was showing her that we already have a technical module for community health promoters on mental health. And I think what we need to do is basically to strengthen the system to make sure that community health promoters are shown how to recognize these mental illnesses and also sensitize the community to understand that it is good, it is normal to not, it is not, it's okay to be not okay. You know, so that they can see those referrals. And so we are working with, our work is basically to, we say to complement. And so we are working with community health promoters, and I think even the role of this conference is to bring together the stakeholders so that we can all sit down and see we are doing something, but is it enough? Yeah.
Right, clap for them. Last question will begin with Peter. The question is there any research on evidence-based of your practices of what you've been doing? If yes, if no, is there plan to do a research to see the impact of the interventions and what you're doing in communities? We are doing this because MRI is going to do a community project, and we want to look at some of the best practices on how to be able to showcase involving. That talked about community development, involving communities. You can't set a program without the communities, they must be involved. you can't also begin a program without having a design and a plan. And these are some of the things that they are going also to get to learn from the panelists as they move on. Research is only speaks numbers and statistics and evidence. Is there any research that you've done to show impact of this, what you're doing, the community? If not, if they are planned? And you can have your second no as you review.
Okay, well, truthfully, for working guards, I have to say we never managed to get some research up and running because of the conflict and difficulties there, but it was always part of the plan, and that's why we worked with local universities there to try and, I suppose, establish a research base. And I think discussions that we've had here, the professors that I've been speaking to, university academics, that it's actually really important to have that research in terms of the effectiveness and the design of what you do, because that becomes a circular feedback mechanism to actually improve and create best practice. In my own professional life, we've always had monitoring and measurement as part of our work, but it's not monitoring and measurement for the sake of getting numbers, it's monitoring and measurement to actually improve what we do. So it's an adaptive management sort of model. You try something, you evaluate it, you learn from it, you change it, and you just keep doing it. You never finish. Whatever work we do is never perfect. We're always trying to make it better. And our society and our communities change, the world changes. We have to track that change. So I think for any design project or any sort of intervention you put in place, it always must be an evaluation or monitoring technique. In terms of the research that supports Greenspace, I'm very confident there's enough evidence there to suggest that it's worth doing. But some of the gaps in the research, some of the gaps in the monitoring, particularly with Greenspace and mental health, are longitudinal studies. So studying how it affects someone's life over a number of years, most of the studies are looking at points in time. So I think this is an opportunity for universities and study centres to build in stronger studies to actually measure how does this affect someone from their birth to their death. These really long studies would be very useful. I've probably said enough.
Right. I see Herbert has a hand raised up. Prof, do you want to ask a specific question to any of the panelists before we move on? Prof. Herbert?
Yes, thank you. Yeah, that was a very interesting comment for me being in the city sector. And I was wondering if for the Kenyan project we can develop a co-creation questionnaire that will address some of the issues you were raising, both of you, in terms of how people feel and how we can develop an appropriate garden, if you like, green space. And then for the longitudinal study, we've been playing around with just taking heart rate recordings through the mobile phone camera, sort of just 2 minutes worth of it. And in many instances, so we did this with sport and with dementia and various other areas, we would then have people just do this on a daily, weekly, whatever basis, whenever they feel like it, hold their finger onto the camera, and that then gets shot to the cloud, and we then get a longitudinal perspective, if you like, at least on the level of stress as per the physiological parameters. Right? Certainly we can also online include a number of questionnaires, so we can do that, of course, like you can bring the PHQ-9 or some other questionnaires as well as required, but this would be another easy way in a longitudinal perspective. So I just thought I'd throw that into the mix. That's it for me.
Thank you, Prof. We've had, from some. Lucy, you've had it very clearly. You want to, yes.
Okay, so Dr. Howard was asking if we can have a longitudinal study. And he was saying that one of the things he's looking at is doing research with the heart rate, where you get to use the camera on the phone to do research. with different people and look at their heart rates and look at how that then impacts different conditions. And I think he was looking at more of the mental health conditions. Yes.
Prof. Herbert, we got you right on a longitudinal study that we can start looking around with institutions, especially with the mobile gadget in terms of heart rate and how we do that with the stress reduction. Is that the right question? Prof. Herbert? All right, so I think that I think we got an idea of what Prof is asking regarding collaborations and partnerships around the study. Among, you remember yesterday he did during his presentation quite a number of devices in terms of stress reduction. And I think for us as institutions, there is Masai Mara here, there's Desa University, and the question is suggesting a development of a co-creation questionnaire. Yes. I think that is very, very welcome. And as we are here institutions, we are in Kenya, particularly if I speak for Desa University, that is something that we would welcome. And we will get the ethical requirements as required as an institution. As usual, we go through different protocols, and that is much welcome. Thank you so much. And we can work with the rest of other organizations that are here to co-create that questionnaire. I think the team here has always our contacts, which we can be able to get through us, and we can always share so that you can be able to reach us and we can agree on the way forward. Thank you so much.
Yeah, great. Okay, I'm happy to be involved and move.
I just wanted to add to the engaging people question. So I just wanted to share you some experiences from Gaza and my own experiences. I think one of the challenges that we're still facing is reaching the people who are suffering the most. Using mobile phones, inviting them to do surveys, inviting them right online. You're not going to capture every person. The person that's most mentally struggling is not going to come or engage with those things. So how do we, I don't have the answer, but I might share some stories with you, but how do we engage the people who are most vulnerable and have the most need? Because I think a lot of surveys and a lot of engagement, you're actually going to miss those people, and we need to get their voices in the equation. So a couple of stories I want to share with you. In terms of engagement in Gaza, we had the challenge of cultural differences, language difficulties, and luckily we had very strong partners who could speak English, even though we had to translate their English several times like mine. That's a joke. But we had strong partners who could actually facilitate engaging the people that we need to speak to. And one of the mechanisms we use is actually art. So it doesn't have to go verbal engagement.